Buprenorphine Hcl Tablet, sublingual, is used to treat opioid use disorder. It belongs to a class of drugs called mixed opioid agonist-antagonists and helps prevent withdrawal symptoms caused by stopping other opioids. It is used as part of a complete treatment program for opioid use disorder, which may include compliance monitoring, counseling, behavioral contract, and lifestyle changes. It is important to ask your doctor or pharmacist if you should have naloxone available to treat opioid overdose, and to also teach your family or household members about the signs of an opioid overdose and how to treat it. The daily dosage and the optimal timing for taking this medication can vary depending on the individual's needs, so it is important to follow the recommendations of your healthcare provider. Before starting sublingual buprenorphine, make sure to read the medication guide provided by your pharmacist. Take this medication as directed by your doctor, usually once daily. Place the medication under your tongue for 5 to 10 minutes and let it dissolve completely. If you are prescribed more than 1 tablet each day, you may place all of the tablets under your tongue at once or place 2 tablets at a time under your tongue. Do not swallow or chew this medication. After the medication is fully dissolved, take a large sip of water and swish gently around your teeth and gums, and then swallow the water to prevent problems with your teeth. It's best to use buprenorphine after signs of opioid withdrawal have begun, but don't start it too soon after your last opioid use as it can cause withdrawal symptoms. The dosage is based on your medical condition and response to treatment. Use this medication regularly at the same time each day for the most benefit. Suddenly stopping this medication may cause withdrawal, so your doctor may lower your dose slowly. If you experience any withdrawal symptoms, tell your doctor or pharmacist right away. Do not inject buprenorphine as it can be dangerous and may cause severe withdrawal symptoms. And remember to tell your doctor if your condition does not get better or if it gets worse. If you experience drowsiness, dizziness, constipation, or headache, it is important to let your doctor or pharmacist know. To prevent constipation, make sure to include dietary fiber in your diet, stay hydrated, and get regular exercise. Your pharmacist can also advise you on which type of laxative may be best for you. To reduce the risk of dizziness and lightheadedness, be sure to get up slowly when moving from a sitting or lying position to standing. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. However, it's important to note that severe breathing problems can occur if this medication is abused, injected, or mixed with other depressants such as alcohol or benzodiazepines. If you experience any serious side effects such as interrupted breathing during sleep, mental or mood changes, stomach or abdominal pain, or signs of adrenal gland issues, it's crucial to seek medical attention. And in the case of very serious side effects like fainting, fast or irregular heartbeat, severe dizziness, or unusual drowsiness, get medical help right away. It's important to be aware that while this medication is used to prevent withdrawal symptoms, it may rarely cause opioid withdrawal symptoms itself, particularly when you first start treatment or if you have been using long-acting opioids. If you notice any symptoms of opioid withdrawal, be sure to notify your doctor or pharmacist right away. Additionally, this drug may rarely cause serious liver disease, so it's important to seek medical help if you experience symptoms such as nausea, vomiting, dark urine, loss of appetite, or yellowing of the eyes or skin. And in the rare event of a serious allergic reaction, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. Before taking buprenorphine, make sure to tell your doctor about any allergies you have, as well as your medical history, especially if you have any brain, breathing, liver, mental/mood, or stomach/intestinal problems, or difficulty urinating. This medication may cause dizziness or drowsiness, so it's important to avoid alcohol and marijuana while taking it, as they can increase these effects. It's also important to be cautious when driving or using machinery. Buprenorphine can affect the heart rhythm, so if you have certain heart problems, a family history of heart problems, or low levels of potassium or magnesium, talk to your doctor before using this medication. Some people may experience dental problems while taking buprenorphine, so it's important to schedule a visit to the dentist soon after starting the medication and to have regular dental exams. Older adults may be more sensitive to the side effects of this drug, particularly confusion, dizziness, drowsiness, and slow/shallow breathing. If you are a woman of childbearing age, talk to your doctor about the risks and benefits of using buprenorphine. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor, as this medication may slightly increase the risk of birth defects. It can also pass into breast milk, so be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. Some products that may interact with Buprenorphine Hcl Tablet, Sublingual include certain pain medications like butorphanol, nalbuphine, and pentazocine, as well as naltrexone and samidorphan. Using this medication with other products that may affect breathing or cause drowsiness can increase the risk of serious side effects like slow/shallow breathing or severe drowsiness/dizziness. Be sure to inform your doctor or pharmacist if you are taking other products such as alcohol, marijuana, cannabis, antihistamines, drugs for sleep or anxiety, muscle relaxants, or other opioid pain relievers. Additionally, check the labels on all your medicines to see if they contain ingredients that could cause drowsiness, and ask your pharmacist about using those products safely. It's important to note that deaths have occurred when buprenorphine has been misused by injecting it, especially when used in combination with benzodiazepines or other depressants such as alcohol or additional opioids. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, give them naloxone if available, then call 911. If the person is awake and has no symptoms, call a poison control center right away. Symptoms of overdose may include slow breathing, slow heartbeat, loss of consciousness. It's important not to share this medication with others, as it is against the law. Make sure to inform all of your doctors that you are taking this medication, especially if you have regularly used opioids in the past, particularly in cases of emergency treatment. You may need to undergo lab and/or medical tests, such as liver function tests, while you are taking this medication. It's important to keep all of your medical and lab appointments. If you have any questions or concerns about these tests, be sure to consult your doctor for more details. As for the daily dosage, the recommended starting dose of Buprenorphine Hcl Tablet, Sublingual is 2 mg to 4 mg once daily. The dose may be adjusted as needed by your doctor. The best time to take this medication is in the morning, as it can help with any withdrawal symptoms that may occur during the day. Be sure to follow your doctor's instructions carefully to get the most benefit from this medication. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take your next dose at your regular time. Don't take a double dose to make up for the missed one. When storing Buprenorphine Hcl Tablet, Sublingual, make sure to keep it at room temperature and away from light and moisture. It's important to keep all medications out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, make sure to properly discard it. If you need more information, you can read the medication guide or consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.